Alcoholism is a disease that involves a strong need to drink alcohol, so that there is a physical dependence to the alcohol. The alcoholic has no control over the limits of consumption and is often elevating over time the degree of tolerance to alcohol. A complex mixture of genetic and environmental factors influence the risk of the development of alcoholism. Genes that influence the metabolism of alcohol also influence the risk of alcoholism and may be indicated by the family history of alcoholism. One paper was found that alcohol use at an earlier age may influence the expression of genes which increase the risk of alcohol dependence. Individuals who have a genetic disposition to alcoholism are also more likely to begin drinking at an earlier age than average. Also, a younger age of onset of drinking is associated with an increased risk of the development of alcoholism. Lack of family support is associated with an increased risk of alcoholism developing. Genetics and adolescence are associated with an increased sensitivity to the neurotoxic effects of chronic alcohol abuse. Treatments for alcoholism include detoxification programs conducted by medical institutions. These may involve the patient stay for an undetermined period, perhaps several weeks. Specialized hospital wards where can you use certain drugs or medicines to prevent withdrawal symptoms. After the period of detoxification, the patient may be subjected to various methods of group therapy or psychotherapy to treat psychological problems of substance that may have to take the patient to the unit. You can also support the program with therapies that encourage the patient to reach the alcohol by medicines like disulfiram, which causes severe and sudden hangovers always when they consume alcohol. Alcoholism is a serious health hazard that often carries the risk of premature death due to liver-type conditions such as liver cirrhosis, internal bleeding, alcohol poisoning, liver cancer, accidents, or suicide. Alcoholism is not determined by the amount taken in a given period. People affected by this disease may show very different patterns of behavior. Those alcoholics that consume it daily as alcoholics who drinks weekly, monthly, or without a fixed schedule. Also, the degenerative process tends to shorten the time between each intake. Prolonged heavy consumption of this substance is forcing the body to need or require increasing amounts to feel the same effects, which is called increased tolerance, and triggers an adaptive mechanism of the body until it reaches a limit which reverses the alleged resistance and then assimilate less, so tolerating more alcohol is itself a risk in alcohol. Deaths from alcohol-related accidents, collisions, pedestrian accidents, and suicides are in first place among the causes of death in many countries. The alcoholism is a serious problem because it affects the people's health, and with the alcohol, the people don't think about what are they doing with their lives. And it's a social problem, and you can see it in all the countries. The alcoholism produces big troubles in the society because when the people are drunk, they make really bad things, such as steal, drive drunk, hurt their family, and other horrible things. Obviously, the television, the radio, the publicity give us some wrong message about the alcohol. For example, some singers use the alcohol in their musical videos. In the television and in the street, there are lots of publicity about beer, whiskey, and some cocktails that can make our minds change our ideas about the alcohol, but we are deceived.